so thanks everyone who's kind of introducing themselves in the chat box now. That's great. It's nice to see a mixture of people here. We've got commissioning managers, short breaks teams, so that's great. So today's session is going to be a bit of a mixture of practice, policy, and kind of some of the kind of impact of COVID on short breaks. But I actually wanted to start off the session. So first of all, I'll introduce myself properly. Sorry, I'm Caroline Coady, and I'm the Assistant Director for Social Care at CDC. And we've been doing quite a lot of work with providers, with our CDC members, and with local authorities across the kind of series of lockdowns to look at where there's kind of flexible and creative practice and learning that we can take from the things that have been happening to kind of move forward short break practice. So what I wanted to do to start off with, and given that we've had a bit of a gap in the way that short breaks have been able to be delivered, was just to watch a short YouTube video, about 5 minutes, just to kind of remind us of what the purpose of short breaks is. So I'm just going to put a video link, into the chat box. So if everyone can just copy and paste the video link into a web browser, you'll be able to watch the short clip on YouTube. The main reason for doing that is that I've tried to share it a few times through Teams recently, and there's been a few technical blips, so it's worked a lot better if everyone just has a watch on their own system. And then once you've finished watching it, just pop a note in the chat box to say finished, and I'll bring everyone back together. So that'd be about 5 minutes or so. So I'm going to post that in the chat box now. When you click on the link, unfortunately, it just takes you straight through to YouTube, so you need to copy and paste it for it to take you through to the correct video clip. So I'll give everyone kind of a few seconds to get themselves onto the right page, and then if everyone mutes themselves and watches the clip, and then we'll come back together and have a bit of a conversation about that. Okay, folks, so I think most people are starting to just finish off the video clip now. So any kind of thoughts or reflections on that, feel free to post in the chat box or to raise your hand if you want to have a conversation. I guess for me, it's just a real reminder that actually, despite all the challenges of the last year, that as part of our kind of recovery plans from everything that's been going on as a result of COVID and the pandemic, it's about really acknowledging how we kind of regain and redevelop some of the opportunities for young people to access their communities, to engage with their friends, and also perhaps to think about the different kind of focus on outcomes for some of the older young people who were kind of engaging activities that were actually really focused on building their independence, building their relationships with their communities, and thinking about what that looks like for children and young people of all ages. So hopefully, as we start to move forwards, I've got a few kind of messages in the chat box saying, it was lovely to see smiling faces, that was really moving. And I think actually we've all really missed the opportunities to do that, but particularly for disabled children and young people, some of whom will have been shielding. They may not have seen support workers or care workers who they had really strong relationships with in any way other than kind of Zoom or Teams for a period of time. So it's about how do we think about a comment, really helpful comment that's just come into the chat, which is how do we think about the offer of short breaks and the benefits of them beyond giving a break to parents. So what is it that we actually think about in terms of focusing them on the outcomes and aspirations of children and young people? Yeah, absolutely appreciate that the budget for flying lessons might have had to be slightly bigger, but then I guess it's about thinking if that's a one-off aspiration and it's a one-off lesson and it's something that young person is really engaged with and gets a lot of benefit from. I guess sometimes we have to weigh up the resource implications with the progress towards outcomes and aspirations for young people. Okay, I'm going to move us on and talk a little bit about some of the work that CDC has been doing around short breaks over the last year, despite everything that's been going on. So back in December, we held an online short breaks community of practice. There was really clear demand for it. We had over 120 participants register. So we had a really mixed group of parent carers, commissioners, team managers, social workers, short break practitioners, early help practitioners, and voluntary community sector practitioners. And we had participants present from every region of England. So it was a really interesting session. And some of the things that we were thinking about with that group on the day were around what is it that we should be looking to achieve with the short breaks offer that we have in our local areas? So there was some thinking about how we have a more cost-effective and sustainable way of planning and commissioning for short breaks. What are the universal services that are accessible to children and young people with SEND? The short break services and provision can be supported to be more effective and more efficient. Developing and embedding practice in the context of social care reform. So thinking about the fact that we've also got the SEND review and the care review across government at the moment, and what the implications of some of that might be in terms of better join up of short breaks and early help provision for disabled children, young people and their families. Building on innovation and best practice and evidence. So we ran a social care innovation programme several years ago, and I'm going to talk a bit more about some of the findings from that later in this session. We were also part of the Short Breaks Partnership, which was who developed the video that you just saw as part of their work previously. And the Disabled Children's Partnership, which has developed a number of kind of reports and evidence on the impact of short break, as well as all of the previous learning that happened around the Aiming High for Disabled Children agenda back from kind of 2008 to 2011. Thinking about how we increase the profile of short breaks. So how are they featured in local offers? What does that look like in terms of a tool to support commissioning? How do we understand the demand and where the gaps are in our local marketplaces? And co-production with parents, carers, children and young people vitally at the heart of all of this development. And I know there are a number of local authorities at the moment who are starting to do some kind of post kind of lockdown consideration and review of their short breaks offers, what that might look like, because actually one of the pieces that of kind of interesting change that have come out of the the kind of lockdown periods, is that actually some of the smaller, less well-known providers have been able to flex and adapt their services more quickly to changing environments, and have ended up becoming kind of more embedded in local areas short breaks offers, whereas previously there might have been some of the bigger providers that had a lot of the services and were better known. Some of those smaller providers are now starting to raise awareness with practitioners, with those people who might be making referrals into services, because they've been able to adapt to the changing needs of the families and the local authorities that they're working with. So building strong relationships, adaptable approaches between commissioners, providers, families and children and young people. I think a lot of local areas that I've been talking to recently about their short breaks kind of reviews and provision have talked about the fact that they've actually been able to build much stronger relationships with their providers during the lockdown, that there have been more regular meetings, there's been thinking together as a local authority and a group of providers about how we make supports and services more available and accessible for children, young people and families during what have been increasingly challenging times, particularly with some children and young people shielding and being out of school. So, and then finally, it was really about sharing learning and influencing national practice. So thinking about how we can bring some of the feedback from those sessions in to support work that we're doing in relation to the SEND review, in relation to the care review, and what that might look like. And with real opportunities potentially for kind of legal reform, particularly in the care review, it'd be really important to think about the needs of disabled children and young people and their families in the context of that bigger scope of that review. So what we weren't really thinking about in that session was increasing thresholds or assessments or rationing services or short-term increases in resource for short breaks. What we were really focused on are what are the things that we can take from our learning of this period that can create some sustainable change and some more accessible opportunities for families. So what I wanted to do was just have a bit of a conversation and give you all an opportunity to share what's been going on in your own local areas. So if anyone would be happy to share some examples of what they think has worked well, either during the lockdown or what was working well pre the lockdown that you'd like to make sure doesn't get lost in the recovery phase. So anyone happy to share something that they're thinking about or something that they've been prompted to think about by watching the video clip, or anything that we've just been talking about in that list of things to think about? Feel free to make a note in the chat or to raise your hands. Lisa. Oh, you're on mute, Lisa.
I thought I'd turned myself off mute. Sorry, good morning. Lancashire County Council, we've reviewed our short breaks offer. This continued through lockdown, which was a huge undertaking, as you can imagine. But what we've really listened to our families in terms of what it is they're looking for from a short break, and we've been able to take some of our learning from COVID and develop what we're hoping to be a really strong offer for our children and young people. And what we've looked at is extending our criteria to include more children rather than lower our criteria. And we're also asking for more money to be able to meet those children's needs. We will hopefully find out next week, following our cabinet report, whether we're going to be able to have more money for our children. But we're hoping to meet the needs of as many children as we can with really, really enriching activities, including sailing on Lake Windermere, climbing walls, some of the things we saw in that video. So that was really lovely to see some of the activities in there that we're trying to develop in our offer across Lancashire.
That's brilliant. Thanks for sharing that, Lisa. Really helpful to hear from you. And I think one of the things that we really need to be thinking about in terms of our short break offer is that actually part of this is going to be really fundamental to supporting the well-being of children and young people as they return to school, they return to socialising. Actually, these opportunities are going to be really vital in terms of that next phase of kind of development around children and young people being supported around their mental health. Alison, can I invite you in? I think you're on mute as well, Alison. Got your hands up.
Can you hear me now? Great. Yeah, we've been doing something similar to Lisa. We've been reviewing our short breaks as well, and we've been really embedding co-production, which has been really, really useful, which has allowed us to start developing a much broader approach in delivering short breaks. And that's embedding co-production not just in the review, but in the actual short breaks offer as it moves forward. So that's given us many more opportunities than what's currently provided. And it's really given us a focus on much better joint working with key stakeholders and partners. So those are our main messages from our review at the moment, which is all really positive.
That's brilliant. Thanks for sharing that, Alison. It sounds like there are some really kind of more flexible and creative approaches coming through to being able to kind of maintain some of that from the lockdown period as well. Chris, did you want to come in as well?
Yeah, I mean, there's a few things during the kind of COVID-19 issues that we've seen with our short break providers that's gone well. Online activities, we found a number of young people who maybe social anxiety, maybe struggled with accessing sort of wider groups, have really responded quite well to some online activities, having the camera off, being able to use chat functions but still engage as much or as little, rather than having to be physically brought to some of the places or having people come into their homes. So we've certainly worked with quite a few smaller providers who have really adapted really well to running sort of schedules, and that's widened their scope, so that actually those with community short break providers who had waiting lists have found that actually a way of they can now meet those demands. We've used our local offer much more creatively to advertise things throughout this time, just to have dedicated pages. And the key thing is we've just received some funding from the TCP cohort from NHS England. We saw high numbers of Tier 4 admissions for young people with autism and or learning disabilities. And so they actually gave us the funding as a local authority to look at doing things like more short break activities to try and relieve some of those pressures and give those families a chance. So actually creative working with our NHS partners across social care and NHS to think about short breaks as a jointly commissioned piece is something that we're going to explore a bit further. But what worked really well was we just put on a range of activities kind of prepaid, and families then self-selected, as opposed to kind of going to the groups. That personalisation approach is something it's working well. It's short term, it's not our longer term kind of plan, but it's certainly given us much more food for thought as to we need to develop that much wider menu of options that families can then self-select based on their child's interest, as opposed to these are the things that we fit on and trying to fit some families into round pegs into square holes.
That's brilliant. Thanks, Chris. It's really helpful to hear that feedback. We've definitely also seen from some of the learning examples that we've developed with CDC across a range of areas that we've had really similar feedback, but also some other different kind of findings around particular key priorities, things to do with kind of risk enablement, risk management, and how do we support that. Right, I'm going to move us on to the next slide now. So thanks everyone for your contributions so far. So I'm just going to talk a little bit about some of the things that we know about kind of some of the previous challenges around short breaks before the pandemic, as well as some of the kind of national evidence that we've seen around short breaks. And this is just a graphic that we developed as part of one of CDC's previous programs of work through the Social Care Innovation Programme. We're going to talk a little bit about the learning of that. Now, the programme started out initially really focused on what was the kind of proportionate approach to assessment for disabled children, young people and families, and what were the challenges in the current system with that, and how could we make that work differently. So this is, I'm not going to go through this entire thing, but this was a bit of a snapshot that identified some of the challenges, some of the areas that needed improving. So we've got kind of a particular kind of tension around transition assessments and preparation for adulthood from year 9, age 14. We've got thinking about actually the experiences in that early intervention end of the system that we've talked about, making sure that there's better connections between kind of early help, multi-agency assessments, and all of those different kind of professionals which need to be involved. And then thinking about where we actually might need some kind of more intensive and tailored support. And there's some really interesting work that's been happening with the Ealing model around thinking about how we keep children and young people with the very complex needs close to home by using a really community-based system of support that is multi-agency and across teams with some really intensive tailored resource to support those young people. So when we were thinking about the development of some of these things in this programme of work, we were thinking about what the priorities are, what are the outcomes for children and young people, but also what are the outcomes for professionals and for the local authorities. So actually, we often, when we talk about co-production, really focus specifically on children and young people and families. But actually, what we learned from the piece of work that we did was actually it was also vitally important to understand the implications for professionals within the systems. Actually, some of the learning that we had from this was that we often think about professionals in silos. So there were some times in the system where we would have changes being made because of practitioners having direct engagement with their managers and opportunities to influence decision making. And what seemed like a tiny change at the system level, which could even be something as simple as changing a form or changing who engages with a family at a particular point of the assessment process, actually had a huge ripple effect on the experience of families that didn't always get taken into account. And then building into that, what are our other systemic constraints, what are our legal frameworks, and where do we have the opportunities for innovation? So there were a few different things that then felt kind of to kind of influence some of those decisions. And before I go into all the learning from that programme, I wanted to just pick up on some of the feedback from the recent short break community of practice that we held back in December. So one of the questions that we talked about was if there was one thing that as a group of practitioners really focused on short breaks for young people and families that we could ask from kind of the government, from the reviews that are happening and all that sort of thing in order to improve access and pathways to short breaks, what would it be? Now, obviously, there isn't one thing here because, of course, when you ask everybody to come up with one thing, 90% of the time, everyone comes up with a different thing. But it gave us a really big list of things to think about and to think about the implications of them in terms of moving into kind of feedback for the reviews, and particularly the care review in terms of that real capacity and potential for legal reform. So one of the things that we looked at was the guidance. And there was some feeling that actually the current guidance, that the language needs to be improved, that it's sometimes ambiguous and open to interpretation and doesn't draw enough on the current evidence, that it's quite old, not specific enough. And actually there is some confusion that arises due to the broadness of guidance. So, for example, having separate short break regulations for residential provisions could make greater clarity around the way that those different services and providers operate and work together. There were a lot of conversations about the potential to update the Chronically Sick and Disabled Persons Act, which is from 1970, and to make it more relevant to today's environment. One of the things in the Act specifically, and that Christine Lenihan, our director at CDC, often talks about from the early years of her social work career, is that the piece of legislation was often used for putting a landline telephone into a family's home so that you could stay in contact. And actually, although there's a real importance in the strength of the duty to provide in the Chronically Sick and Disabled Persons Act, which also includes essentially the equivalent of what would be a short break, kind of a daytime short break. The only bit that sits outside of the Chronically Sick and Disabled Persons Act at the moment in terms of short break provision is overnight short breaks away from the family home. But actually, you know, how do we modernise that? How do we keep the strength of the duties for provision, but how do we modernise the legislation and make sure that it's joined up and effective? The next bit was thinking about emergency support packages. So short breaks generally are planned, and it's not always possible, therefore, to provide an emergency solution. So is it a short break? Is it accommodation under Section 20 of the Children Act? And actually, we're going to talk a little bit more about the legal framework that kind of underpins some of this later this session. Although you'll be pleased to hear I'm not going to go through it in great detail, but what I am going to do is leave you with a set of slides that sets out the information of the legislation that underpins some of this. A real focus on building inclusivity in universal providers. If we think about that early intervention, early help end of this system, that is where short breaks should sit. This is a support mechanism that should prevent families going into crisis that should prevent families needing to access those higher tiers of care and support under the kind of social care framework. But actually what we often see are families going into crisis, presenting for a Section 17 assessment, and short breaks ending up being really a response to crisis support rather than that early kind of intervention and preventative care that they can be. Minimum standards or standardisation, there's been some conversations about whether this would stop the kind of postcode lottery or the challenge around short breaks being different across different areas. And actually that's not to do necessarily with the type of short break. Actually different areas and the different kinds of geography, landscapes, groups of young people and populations of need are really important in terms of determining what that local offer of provision looks like, but actually really importantly having that process that informs commissioning, that consideration of joint commissioning across health and social care, and also that focus on working with providers to ensure that they also understand the outcomes that we're trying to achieve for children and young people. Multidisciplinary working, we know that this is embedded in law now, but it's also essential to help raise awareness of what short breaks can do. Short breaks are not just a social care, they don't just meet a social care need. There are a whole range of needs that short break opportunities can use, and we need to raise awareness of that across different providers to enable those services to be more flexible and to meet the needs of a wider range of families. And then inevitably, we've got the situation of funding, which of course there have been real fluctuations in the funding and significant cuts to funding for early help and early intervention in the last few years. And actually one of the things that we will be hoping that the reviews will start to look at is what is realistic and fairly distributed funding and support for this early intervention tier for families. And then the costs and process for companies to register for personal care is costly and lengthy, and there's some desire around how we can maybe simplify that. So I'm just going to move us on now to share some examples of different things that happened around a whole range of things in the Social Care Innovation Programme, CDCRAM. So we've got the name of the programme was Transforming Culture and Practice, and this was really focused on a whole series of elements. And so this first one picks up on that issue around raising awareness, raising information, and also empowering families to know where to find what they need to be able to access support in a proportionate way. So we had 5 local authorities that we were working with. You can see them here. So Bromley developed their Time for Me approach. They worked with a family. They had video clips from young carers, from siblings, from parents, and from individual young people themselves about how they created that space and that time for them and the support that that gave for their well-being and their mental health, as well as enabling them to engage in things that they enjoyed. From West Sussex, they developed a really lovely video clip which was developed by disabled children and young people for disabled children and young people to explain the social care assessment process. There were information leaflets for families from Enfield, which we've got some clips here of, and a video from Cornwall of young people explaining what it is that they want from their social worker, what are the skills and the values that they would appreciate. And then in York, there was a whole programme around training up volunteers, including parent carers, local authority staff, and even community library staff to actually support families to navigate community support, the local offer, and also to support them through any of the early assessment processes that might happen if they were required. So there's a link there, and you can find all of the information, including tools and resources to download in our website there from the link. So this is just a couple of examples, and because I'm conscious of the time, I'm not going to go through them in significant detail, but you'll get the slides back after the session. So this was one approach in Cornwall that was about a kind of let's talk conversation as a preventative intervention. So this was about developing an early help intervention that was really focused on the needs of disabled children, young people and their families. So it's about thinking about achievable goals that improve outcomes for disabled children. And it kind of led on from the basis of a signs of safety approach, which I'm sure many of you will be aware of. And then these are just some headlines about what we learned about co-production. And I touched on some of these earlier in the session. So having all of those parent carers, professionals, children, young people, all in the same room discussing the same challenges in a really solution-focused way actually led to a much greater understanding of roles and responsibilities. And many of the parent carers that were involved fed back that although the situation and the solution wasn't always the one that they'd envisaged from the beginning, actually the process of developing that with practitioners in partnership really developed trusting relationships between those groups and enabled kind of open conversations about much more difficult topics. So this section then is essentially just a refresher on the law and guidance, and I'm not going to go through this in detail, other than just to say that there is a whole raft of legal duties, and they relate to the commissioning and provision of short breaks by local authorities. And the duties are to individuals and to groups of children and young people and their families. So this is at a population level as well as individual duties. So there's a specific short breaks duty, which is about defining what the local authority will provide and how services will be designed. And your short breaks duty as a local authority area must be available in your local offer. So the 2011 regulations around short breaks for carers of disabled children identify a number of key regulations, and there are 3 that I've pulled out here. So regulation 3 is the duty to make provision. Regulation 4 is the types of services which must be provided, and regulation 5 is that regulation about having a short break services statement. So as I said, I'm not going to go through all these specific duties now, but they underpin all the reviews and the different types of thinking that we should be doing in practice around how to develop different approaches or more proportionate and streamlined approaches, given the learning that we've got as we came through lockdown. So I'm just going to finish off with a couple of key points now around the call for examples that we did in lockdown. We had 14 responses to a very short call for examples, and this was during the first lockdown back at the beginning of last summer. So we had a number of key kind of learning things, which were around ongoing communication with families, kind of understanding and acknowledging that families' needs for support fluctuated during the pandemic, and some of those families who really were perhaps coping well and really engaging at the beginning of the lockdown and felt comfortable that their support didn't need to go on. Actually, as the time progressed, it meant that it became really challenging for them, and actually their needs changed, and that was really important to have that ongoing communication to enable those things to happen. Creative use of technology, which we've already heard a bit about on the call, and actually the remodelling provision of support and responsive decision making, and this is really crucial for us from a local authority level, was about actually in some areas where previously short breaks provision would have been only accessible via a Section 17 assessment from a social worker in the disabled children's team. Actually, we were seeing much more kind of focused support around decision making being delegated down the chain of command. So instead of a full Section 17 assessment and then a short breaks panel, for example, that might take place once a month, what we were seeing was decisions being made by team leaders of social work teams that actually meant that support was much more responsive. So this is just a link here to the resources from the CDC's website, and here are a few bits of key learning. So for those areas who were able to really quickly work together, that was the most effective thing. And actually, a number of the barriers to joint working we heard kind of came down as a result of some of the kind of high risk challenges that were forming for young people as a result of the lockdown. So actually, what was really important was very quickly developing systems that allowed areas to work together to identify the most vulnerable children, young people, and families, to make decisions and where appropriate delegate that responsibility to different levels of the system, and to have that ongoing communication, but also about being flexible in supporting families where children and young people were or were previously shielding, and to ensure really robust staff training so that staff feel confident and able to provide the necessary support to families. So I'm just going to quickly finish off this session because I appreciate you have somewhere else to go, with just a key message from all of the providers, which was that risk assessment should be used as an enabler to providing support rather than a barrier. And one of the quotes from the providers that we worked with said that risk assessment, which supports effective risk management and creative thinking, has led to different approaches to face-to-face support rather than support being withdrawn, especially for children, young people and families who were particularly vulnerable or at high risk of going into crisis during the pandemic. So just a final thought and a final reminder is just this difference between equality and equity, and thinking about in the front of our minds when we're thinking about our short break programs and our inclusive universal services is how do we create that parity of opportunity for disabled children, young people to access short breaks, to access their communities and to access leisure facilities, and in order to support them to progress towards their outcomes. Okay, I'm going to stop there. I think everyone's got another workshop to go to, Hope, or is there a break first?
I think there's a little bit of a break, but yes, so that's the next workshops all start at 12:30.
Okay, so if anyone's got any questions or anything else that they wanted to share, I'm more than happy to do that for the next couple of minutes. But otherwise, thank you all for your time, and the slides will be shared with everyone after the session.